Okay, thanks, Linda. I guess I'd just like to welcome everyone to the February edition of Cattle Chat. Today we've got two different speakers on two different topics. First, we're going to start off with Dr. Roy Lewis from Merck Animal Health. He's going to be discussing protozoan diseases such as Crypto and Coccidiosis, which I think is a very timely topic for guys that have started calving or that are just getting into calving now. And then following that, that's going to take up the first probably 45 minutes of the presentation. And then next we're going to have Linda Fox from MAFRI. She's going to be discussing the next generation of calving records, the iCalve app and some different applications that are available for your smartphone that can make record keeping a bit easier. So I guess we'll turn it over to Roy, and he can kind of give a brief introduction of himself and get going.
Well, good morning, everybody. Yeah, it's Roy Lewis here from Merck Animal Health. I've spoken on a couple of these other presentations on Cattle Chat, so you may be familiar with me. What we're going to talk about today is, as Andrea had mentioned, is two protozoan diseases. So we're going to sort of delve off into scours and diarrhea a little bit, but I'm going to concentrate on these two diseases primarily because I get asked a lot of questions about them at producer meetings and that sort of thing, and they're difficult ones to treat, and it's all about prevention with them. So it ties in with a lot of the other scours preventions that we want to talk about. So we'll sort of kill two birds with one stone today. The slide in front of you right now just shows pre-weaning mortality of calves on heifers, and as it probably no surprise to anybody, half of the death loss is scours. So that's why we really want to scours as a general topic, look at it and try to figure out ways we can prevent that problem from occurring on your farms and ranches. As you see, the other one, respiratory disease, obviously is another big one. So those two, if we can work on them collectively, we can get rid of a lot of the death loss on our farms. This is the sort of thing you don't want to have happen, right? It's a down and out calf. You can see he's really dehydrated and sick looking. It's wet conditions, not a lot of bedding, a lot of manure contamination. These are how these scours outbreaks started, and really the whole goal here is to prevent the very first calf from getting sick, because he's the one that contaminates half of the rest of the herd in all scours outbreaks. So if we can do a lot of prevention to prevent that first case, we'll go a long way to preventing scours in general on our farms. So the big thing for veterinarians is to help you figure out is what caused the scour outbreak, and if there is always something we can do about it. But the big thing for me is really prevention. If we can prevent these things from happening, that's the key to really managing our herds and saving ourselves a lot of grief. So that's what we're going to delve in today with these two coccidian diseases. You can see here the sort of balancing act between the cattle, or the little cows when they're born, how resistant they are. So that's going to depend on colostrum, surround, they're out of the weather and the elements, those sorts of things. But the key is over on the left-hand side when you see these different pathogens. And the viruses and bacteria, we're not going to talk about today, the E. coli's and corona and rotavirus. They're in most of the scour vaccines. And I'm sure you know about them. So a lot of them are looked after with the vaccination and incorporating those other management things. The protozoan diseases, coccidiosis and cryptosporidiosis, are the keys, the ones that really there's no vaccine for. So that's why we've got to look at other management ways to kind of prevent them from occurring. So this is the sort of thing you don't want to have happen. I just threw this slide on here for the simple reason of, if this was your calving area, you can see how contaminated it is with the manure and the cattle. The cows have been running out there all year. You really want a clean area to start calving in general, and just calve the cows in that area during that critical time, so that the area is clean and you don't have a lot of contamination from the whole winter and those either viruses, bacteria, or these protozoan diseases. Basically the concentration of the organisms happening. Because when I get into talking about the life cycle, which I think is coming right up, I'm just putting this on quickly, but again, the infectious agents we talked about, protozoans, are the ones we're going to look at today. The management things on the other side, the failure of FPT, meaning failure of passive transfer. That's the lack of colostrum, overcrowding. You want to have lots of room for them in the calving area, and lots of bedding and that sort of thing, and obviously nutrition comes in there as well. But we're just going to move along here. Both Coccidia and Crypto have kind of an unusual life cycle in the sense that it's kind of like worms and parasites. It's really what's spread is the little oocysts, or the eggs that are dumped out in the manure. The whole rest of the life cycle happens in the intestinal tract, where both those organisms damage the intestinal tract and give the calves diarrhea. This shows a cow as involved in the life cycle, but why it is that's where the calves get the contamination from. Cows will shed Coccidia and Crypto, the little eggs, routinely, and yet they're not sick. But they're the ones that kind of shed out onto the environment, and the calves are the ones that are susceptible and pick up these organisms. So the cows are kind of the carriers, and that's okay as long as they don't have a big level of them. But the calves are the ones that will get the clinical disease from it. So that's probably the most important thing to understand. And if I think they can see my mouse moving here, hopefully. Basically these oocysts come out, and then the calves pick them up, take them in, and they're the ones that get sick from that. But both life cycles are very similar, except Coccidia is a longer life cycle, and I'll show that in a minute. Crypto is a very quick one, and within a few days they can take in the organisms, get sick, and be excreting those sort of eggs out the back end within 3 or 4 days. So it can be a really quick epidemic outbreak of it if you get it in your herd. I could spend the whole talk on this slide. I really like this slide just because it shows the Coccidian life cycle now, and it's quite a long one. You can see that it takes up to about a month basically for the calves to take in the Coccidia, for them to multiply in the gut and then get sick and then excrete the oocysts. So it's a real long one. So we've got a little bit of time to prevent stuff on it. It also shows in the blue there the different treatments you can use for coccidiosis, and a lot of them are the preventatives that I'll touch on at the end. But you can see decox there, and what it's showing is the stage of the life cycle that those products work in. So things like the ionophores, so Rumensin and those sort of things you can put in, and that's why it's got to be in for a long period of time, just because it works on a specific part of the life cycle. So if you're past that, you're already too late. So all these things pretty much have to be preventative. The only real treatment we have for coccidiosis, you see sulfas here, and that's the old sulfa drug. So that would be things like injectable Borgal, sulfamethazine in the water, those sorts of things that's the only antibiotic that will work against coccidia, because it's a protozoa. So normally antibiotics don't work against protozoan type diseases. So you can see it works relatively late in the life cycle, and that is when you would see clinical disease. So where it says day 18 and 19 down here, where it's clinical cases, that's where you see the straining calves with blood in their diarrhea and that sort of thing. And that's where you could go in with something like sulfas and treat them, but really what we want to do is treat and prevent the disease from occurring by treating over here in the life cycle. So if you know you've had coccidiosis before, you can do varying things to try to minimize the spread of that disease. Because once you get, again, one calf infected, what's going to happen is it's going to discharge lots of those little eggs down here at the bottom of the life cycle and dispense them out in the manure, and then the other calves can be infected from that. So one thing to talk to your veterinarians about, if you're trying to diagnose it too, you can get calves getting sick and actually have coccidiosis, but when we check in the manure for these oocysts, or these worm eggs, we won't see them yet because they haven't got to that stage in the life cycle. So it's important to have your veterinarian know the fact that, and he would know this, but we sometimes forget these things. I know people think veterinarians never forget anything, but we do on occasion. So sometimes it's a matter of rechecking those calves later, and you will find them and diagnose coccidiosis. For all the dairy lovers out there, I just wanted to throw in same exact life cycle on dairy calves. Dairy calves are no different in the environment that they're in. They can get coccidiosis fairly easy. in the feedlots, we pretty much prevented it because they give those ionophores, so they give stuff like grumensin in the feed all the time, so as a result they kept coccidiosis to a minimum. It's in the young calves that we run into these diseases that are hard to treat. So if we look at the age of calves, that when they get sick, again I mentioned the E. coli, rotocoronavirus, they're in your scour vaccine. So if you scour vaccinate, you're going to be able to kind of minimize them, hopefully. But again, it will not totally eliminate them if the concentration of these organisms gets high in the environment. But crypto is one that, again, no vaccine for, as I mentioned, a different protozoal disease, and they will get it at between usually 4 to 5 days is about the minimum, up to about a month. So once calves get a month of age, or older, they won't get it. They've got an immune system such that they won't get it. But if you get calves in that, again, usually 2 to 3 weeks is kind of the real maximum outbreak period for crypto, have, again, your veterinarian check and see if you can't diagnose it. We've got better ways to diagnose it now than we did in the past, and I think, again, veterinarians over the last 10, 20 years probably missed this disease. It was probably out there and we didn't see it. Coccidiosis, generally you're not going to get it for calves until they're 3 weeks of age or older, and they can get it up into the months of age, right? And we just talked about it showing up in the feedlot. So it can happen in older animals as well, whereas crypto is confined to those ones that are usually under a month of age. Then this graph just basically outlines that. So if you're working again with your veterinarian and you've got a scour issue, it's really critical the days of age that the calves get sick. They'll often ask you when are they getting sick, because that may help them pinpoint what disease they've got. E. coli will always show up in just a few days of age on those calves. Rotocorona a little bit older, but you can see a big overlap here between the viruses and the crypto. And a lot of times these infections will come mixed. So about half the time crypto may be diagnosed, it's a sole problem, and other times it's mixed in with those other viruses. So you actually have two things going on at the same time, and it's critical to kind of find out what that is. Over on the right-hand side, you'll see these other diseases that will get in calves greater than a month, and that's where coccidia comes in. So it'll start at a month and then just carry on right over for basically till an animal's kind of mature. Oh, that went backwards, didn't it? Yeah. Okay. And this just shows a crypto life cycle. I won't spend a lot of time. It's a nice little pictorial on a little calf, but basically they're taking in those eggs. So what you want to think about is the environment has these oocysts in it, or these little eggs that calves being inquisitive, drinking water, licking manure, licking each other, that sort of thing. They pick it up. It goes through a replication phase in the intestinal tract, and then they spit out millions upon millions of these oocysts for the other calves to pick up. So that's where it's real critical. If we can eliminate the first case, we'll go a long ways to keeping this disease out of your herds. The real key, I guess, is really diagnosing what the problem is, and scours is a real non-specific term. So really, veterinarians will often ask a whole bunch of different questions of you as far as, do you scour, vaccinate, and try to eliminate which ones it may or may not be. So really the clinical signs that you get, other than just straight diarrhea, which is common to all of those things, but really the age of the calf, as we've gone over, the older ones maybe coccidiosis might be more likely, the middle-aged ones, crypto and the viruses, and the real young ones, E. coli. We can help eliminate or determine which organism might be involved. There's also a product, and I just threw this down on here. It's not a product Merck carries, but it's a really good diagnostic one. It's called BioCheck. It's produced in TerraCheck. Actually, crypto is a specific one, but there's other ones that they check for different diarrheal diseases from a company out in Quebec called BioVet, and it's specific for crypto. The clinics can get this test in the clinic. So basically, you just bring in a manure sample. They can check it and find out if crypto is there. And then once you find out it is there, well, then you know what to do to prevent it or help treat the cases this year and really prevent the ones next year is what you're after. The other thing with these both protozoal diseases, if you do your normal scour treatments, which might be antibiotics and fluids, the fluids will help, but the antibiotics won't. So both of these will be usually unresponsive to treatment. So that's something else to consider when you're treating these. If you're not getting a lot of response to treatment, get them checked out to find out what's going on exactly. And again, with coccidiosis, I'm sure a lot of you have seen the the bloody kind of black stained butt of a calf or frank blood coming out of their butt, and they're straining and really irritated, and that's a real good indication there might be coccidiosis going on there. So keep that in mind as well. Great picture for lunch, but anyway, this is a real classic to me, a crypto case, and the only way I can describe these things is they usually look like they're passing undigested milk, and that's kind of what they're doing. The crypto destroys a lot of the crypts, or the kind of areas for digestion and glandular parts of the intestinal tract, and the milk almost passes through undigested. And when it does that, you get kind of a foamy looking, yellowy diarrhea. And it's not for sure that it's going to be crypto, but because the viruses can kind of do that too. But it's one of the telltale signs with cryptosporidiosis. So any cows with this kind of manure coming out the back, good indication that may be that. Just wanted to go over the source of infection for these things. I mentioned these oocysts, which are like little eggs that they're almost like worm eggs that they pick up. They're very small, they're microscopic, but they can stick to anything. They're very resistant to in the environment. So they're shed, as I mentioned, in the cow's manure, and then when a calf gets sick, they're shed in the millions, if not billions, out into the environment. So they'll also collect in the spring water, runoff water that washes down through the manure packs in the spring, and it collects, and then the little cows want to drink it. So that's often a source. Owners can obviously spread it in their coveralls, boots, anytime they're handling the calves. That can be another way of doing it. And they're in the manure sometimes from the year before, so that real good cleaning of the calving area the year before will help remove those. So that's a really good preventative thing. And then keeping that area until they calve will really reduce the oocysts that are out there. And one thing to consider is the oocysts are immediately infective for crypto right when they come out the back end of the calf. So the minute the calf passes those things in the environment, they're infective to the next calf that comes along. Coccidiosis takes about a week for them to become infective in the environment, but probably a big difference, but a little difference in the sense you just have less time, and that's why the crypto life cycle happens so fast. So they take them in, and within 4 days they're spreading them out, and they can immediately be infected again. So it's really, really quick. This management prevention for these, this doesn't just apply to these protozoan diseases, but any kind of bacteria, any type of scours, organisms. I mean, obviously good biosecurity things, which proper manure removal, and ideally spreading it on grain land and not pasture land probably will help. Obviously lots of bedding in the calving area, that just goes without saying for any kind of scours. The thing, and avoid overcrowding. This is a good thing to keep in mind too, is the square footage that a cow-calf pyramid needs. This has been sort of around, this number's been around for quite a while, 2,000 square feet. And I know I don't want to get everybody out there with a tape measure or anything, but the easiest way is just, if you got distance in between your posts, right, and you just count the posts and figure out roughly what the square footage to, length times width, and divide it by how many cow-calf pairs you have in there, and it's pretty easy to come up with a number. But this is one that I've seen huge scour outbreaks in guys, and you know darn well when you get there that it's super concentrated. You can just tell the cows and calves are on top of one, and then again, if one gets sick, you've got a bunch sick before you know it. Controlling those other diseases that you can with scour vaccination is a good way to go as well, to get that protection coming over in the colostrum. So if we can prevent those other diseases from happening, we're less likely to get these protozoan diseases as well. And really the goal, again, as I've mentioned already a couple of times, is really to prevent the first case. If we can prevent the first case, if you see a first case, get it out of there and isolate it with its mother in an area that you're only going to put sick calves in. That will go a long ways too. You get it out of the herd and prevent it from spreading. And then, of course, the old other adage that works pretty good, if you're ideally set up this way where you can put 50 to 60 cow-calf pairs, depending on the size of your herd, in one pen, and then start a new pen for the next 50 or 60 so you don't get them all concentrated together. If you do get a few breaking, it may just be in one pen, and you can confine it to that pen would help as well. Because again, those oocysts are going to be spread just in that pen, and at least the other pens aren't exposed to them. Yeah, I know we found, and Merck has done some work across Canada on deworming in the last little while, and the other thing just to throw in there, if the worm level is really low in the cows or calves on pasture, what we found as a secondary result to this is the coccidia would have a tendency to go away. And the reason for that is just it's less stressful on the immune system. So you remove the worms, the immune system of the cow responds, and there's less coccidia shed out. So that's just sort of a secondary benefit to making sure the parasites are down in the herd. I wanted to spend a little bit of time on preventative treatments for coccidiosis, and I'm not giving any doses or anything here. This is kind of really a little bit up to you, your veterinarian. A lot of times a nutritionist is involved in this because there's different ways to get these products into the cattle. And for preventative for coccidiosis and really crypto, there's really not a lot that's been tested for treatment. It may help secondarily, but for coccidiosis, giving the ionophores, so stuff like Rumensin or Bovatec, can be given to the cows 30 to 45 days ahead of the calving period. And the reason for that is you eliminate that shedding that I talked about. Even though they're not sick, they shed small amounts of those oocysts that contaminate the environment. So by treating them 45 days ahead of calving, you minimize that. So you minimize the shedding of the access for the calves. That's one thing that can be done. And then I just put in there too the no access to horses. Monensin is very toxic to horses. So if you're in a kind of a situation where you're feeding the Rumensin, whether it be in the total mixed ration, which is probably the best way to go, or you can't get it and script it in or put it in the minerals in a more concentrated form, obviously, but it has to be worked out with a nutritionist how much you would put in. That, I mean, you just don't want to let horses have access to that. The other product is Decox, and if you recall if I went back, and I should have it on here again, but the slide that showed the life cycle, Decox is effective pretty much in a good part of the life cycle of coccidiosis, and it can be put in. There's different ways. I've worked with producers at putting that in. Usually it's more we concentrate on the calves when they're born because, as I mentioned, coccidiosis, they usually don't get till about a month of age and older. And usually they're on creep feed by then, or they're on minerals or that sort of thing. So you can mix it in. Again, work with your veterinarian for the amount that you would have to put in to the minerals. If you're giving minerals to calves in a creep area, that would be great to try to minimize coccidiosis. We've got a producer in Alberta that's actually worked with mixing Decox in with diatomaceous earth too, and so there's a formula out there that you can work at getting Decox put into diatomaceous earth if that's what you're putting out for the calves. Because all these things, basically what you're trying to do is minimize and treat, sort of preventatively treat the calves so that we don't get that first case shedding out all over the place. So the less of these organisms that are out there, less likely any of the animals are going to get sick. And Prolium's not a favorite of mine because it doesn't work in a big stage of the life cycle. It's usually mixed in the water. It was developed and used a lot in chickens, works very well for coccidiosis, but just the application in cattle to me is a little bit harder, and that's I just wanted to throw that out there to give you all the angles. There's also some off-label stuff that has been prescribed for coccidiosis or cryptosporidiosis, and again, talk to your veterinarian. I know it's being used in Manitoba in some clinics and seems to be effective. It's called tetrazerol, but it's an off-label thing, and it's a compounded product. So again, work with your veterinarian if that may be something that he or she wants to use as well. And the other thing to remember is coccidiosis is immunosuppressive, so it's the old chicken or egg thing. Coccidiosis, you can get it and suppress the calves such that they get other diseases, or other diseases suppress their immune system, and then coccidiosis comes in. So it's sort of which came first, and if we can minimize the coccidiosis, hopefully it may prevent other diseases from occurring in your calves as well. So again, when we get back into the treatments, I'd rather prevent it. I think it's really these two diseases are ones, if you're treating one, that's kind of the tip of the iceberg. There may be others that are sort of subclinical in the herd, and really you want to work at preventing it as much as you can. If you do get treatments, obviously you don't want to just leave them there. You want to look after them from an animal welfare standpoint, separate them if you can. And for all these scour things, it's a matter of giving supportive care, such as electrolytes, non-steroidal anti-inflammatories, like that's a product called like Banamine or Metacam or other ones. They're prescription products that your veterinarian may prescribe. We usually go with stool hardeners such as keopectate mixed in with the electrolytes, and that kind of, in my mind, I guess, soothes, for lack of a better word, soothes the guts so that you don't get the straining with coccidiosis. With coccidiosis, the potentiated sulfonamides, I mentioned products like Borgal that may be familiar with. Trivetrin was another product that's, I think, just off the market now. But actually our company had both of them because with amalgamations and stuff, so we just elected to market the one. But it is one antibiotic that will work fairly well. Some of you may be familiar with these Coxibolo tabs that were around at one time. They're now off the market, but they had the potentiated sulfonamides in them as well, with charcoal to kind of coat the gut and soothe the gut and all these sorts of things. So again, hopefully you'll never have to treat cases, but if you do, there is ways you can go about treating them. Crypto, just wanted to mention this briefly. The only real licensed product, as I mentioned, there's a bunch of off-label stuff that's being tried out there on beef calves. Crypto, the only real licensed product and it's licensed to reduce shedding. So it basically won't cure them of the disease. It just reduces the shedding so others around them don't get sick. And it's called a product called Halicure, or halofugenol is the active ingredient in it. It is one that Merck carries. It's the one good thing about it is quite effective, but you've got to treat a whole bunch of calves around the one that's sick. So really, if they're real sick, you give the supportive care, and if they're born around that time, you treat a bunch of them. It's supposed to be given 7 days in a row. So the negative is it's got a real good application in the dairy industry, but in beef cattle, I'm not sure if you could catch a calf 7 days in a row. I know I couldn't, but so it may even be tried a few days in a row, and it may help. But I'm just throwing these ideas out there because there's crypto is a difficult one to treat. So again, you can see here, and I think if there's any questions, I wanted to make this talk fairly short in the sense that a lot of times I find the questions are really good, specifically on cocci or cryptosporidiosis, because ones that are applicable to your farm is what we may be able to handle. So hopefully there'll be some coming in because I'll be finished in a couple minutes here. This just shows the product Halicure, but what it basically does is it just blocks this replication phase inside the calf. So they still take in the oocysts, and it just blocks that replication and reproductive phase of the organism. So then, of course, it cuts down the amount of oocysts that are coming out. And the minute you cut down the number, the others are exposed to just a little bit. They might even develop some protection and don't get sick. That's the whole name of the game. And then they carry on to be normal animal calves after. So I probably talked a little quicker than I thought I would, but that might give a little more time for the other speaker as well. But I just wonder if there's any questions, and I can forward it back to Linda or Andrea, I guess. I'm kind of a bit of a bison fan, so I always throw this out. I've raised bison. If they did get scours, A, I wouldn't know, and B, I couldn't catch them, or I'd get killed trying to treat them. So it's the big thing, again, with bison, a lot of you guys that calve later don't have quite the issues, too, because you can get them spread out. So, again, that 2,000 square feet I talked about is more in the spring. If you get them spread out on a quarter section, you've got way, way, way more room than that. So that's where you just don't get these scouring diseases often.
Okay, Roy, I think Linda Fox, the other presenter, has a question. Go ahead, Linda.
I was just wondering, you talked about briefly the kind of days that the livestock are affected. So does that mean, I mean, I don't think I've ever seen clinical signs in a cow. Is she actually affected by the ingestion of those oocytes or oocysts, or are they resistant because of the way their gut functions, or?
Yeah, good question. Yeah, the cows are just kind of the carrier like this, so they're non-symptomatic carriers. It doesn't affect them in any way. The amount that they're shedding is very, very low of both those organisms generally, and it's an inherent resistance thing. So once they get a little bit older, they're natural carriers of it. So the only reason we would treat the cows is really just to reduce the amount of shedding on the pasture. You're right, they're not clinically affected at all, and that's why you've never seen one. But they will vary. The rate of them shedding will probably come up a little bit at calving time too, which is kind of the kick in the pants here, this sort of thing, because right when you don't want more shedding in the environment, you probably get a little bit more, and the reason is they're a little more immunosuppressed because of calving and all the stress that they're under at that time. Again, they don't get sick from it, but they may shed more of those organisms, and that's a little bit why we have more trouble with it in calving and with calves, because they're exposed to more at that time of year.
And you had mentioned that subsequent years of calving on a pasture that has had instances of one of these diseases could cause an outbreak. So they do overwinter, I'm guessing, through the freeze-thaw cycle. And how long do we expect, or has there been any research done to see how long they do survive?
Yeah, I don't recall any research as into definitely the coccidia overwinter. The other thing, just from disinfectants and stuff, they're both very, very resistant to that. The coccidia will stay there a long, long time. I mean, they're very, very resistant in the environment. The crypto probably lasts a few months, but not much longer than that. So really, the ones the following year, you're kind of almost starting with a fairly clean slate with the crypto, but again, the cows are just shedding a little bit of it in the environment. So the cocci is more of the critical one as far as spreading the manure and that and getting it out of the area, because it will overwinter and be there right in the spring when, even if they've, if you have them in the same pen, let's say in the fall, and they carry on all over winter, and then the snow melts, it'll wash those coccidia. They'll be very infective at that point. And it may go out even years with coccidia, but I haven't seen any studies to that effect.
Thank you.
Okay, actually, I have a question here. I'm not sure what it's regarding. Sorry, I was answering a call, but it says 2,000 square feet seems large. Could you clarify that?
Yeah, not really when you think of it, because it's, I'd have to do what's the square of that? 30 by 30 is 900, so even, what is it, 50 by 50 is 2,500. So it's not 50 feet by 50 feet. But if you think of a pen, and what I'm talking about here is maybe not the specific calving area, okay? So you may have them tighter than that. I mean, you usually have the cows calving where you can almost touch one another, right, at night. But where you want to calculate that is when you take those 50 cow, as the cow, most people anyway, as in the bigger herds, as the cows calve, they take the pair out and put them in another pen, and it's where those 50 are in close proximation for all that time. That's where you want to count your posts, your distance between the posts, length times width, and you'd be surprised once you get a little bit of length and a little bit of width. You get a lot of 2,000 square foot areas in a type of thing. I know it seems pretty, and some guys might be a little less than that. That's the ideal. That's been found to be, kind of an ideal or bigger, obviously. But I mean, if you, where I'm talking about where guys had them crowded in, I figured it out, and they were down into that 500, 400 square feet. I mean, they're just about stepping on one another when you think of it. So, you might be able to get away with 1,000, but I mean, once you get less than that, they are really tight. So yeah, just do that and see what you come up with on the measurement. I think you might surprise yourself how big your pens are. But again, it's where those 50 or 60 cow calf pairs are put. That's the time you're calculating the square footage.
Okay, great, Roy. I don't have any more questions. Andrea, did you have any questions?
Yeah, I've got one quick question for Roy. I guess it's more on the side of treatment. When we're giving the electrolyte treatment every couple hours, and then when would you suggest adding in the kaopectate? Is that something you start right off, or is it something, once they get rehydrated again, then do you alternate between the kaopectate and the electrolytes, or how would you suggest going about managing that?
Yeah, that's a little bit of a kind of witchcraft in the kitchen thing for me a little bit. I usually put in a couple ounces of most of those commercial products with one treatment. Usually, I guess it would depend on the severity of the diarrhea. A lot of times, if you catch these calves early, they might only take 1 or 2 shots of electrolytes, and then they're on their way if you get them early and that sort of thing. So we'd probably put that in at least once a day, maybe twice a day. But yeah, if you're giving electrolytes 3-4 times a day, I would probably only give it a couple times. You run the risk a little bit, and it's again one of those judgments things. Once you start getting them tightened up, you don't want to keep doing it because they are stool hard. Like they can go the other way, and you can half plug them up too. So you kind of got to watch that you don't overdo that. But I think what you're doing there is again coating the gut, helping them tighten up and not lose so much fluids, and that's kind of my recommendation anyway. But every veterinarian will vary it a little bit, and depending on the product they're using. But it's a very safe product to give and easy to mix in with the electrolytes, and that's why I do it.
Roy, have a comment here from Wayne Tomlinson. I just want to agree with Roy. Crypto is fairly common in southern Manitoba. Most producers don't realize they have it because they don't often do cultures. Many call or refer to it as milk scours. They don't worry until years when it gets more severe due to complications from other diseases or weather.
Yeah, that's a fair comment, and I'm glad that Dr. Tomlinson's listening and keeping me honest. We work back and forth here in Manitoba, and it's good to hear he's on the line. But yeah, I would agree, and I wanted to add the comment. I think a few years ago, even when we were called to investigate, we probably, in fairness, veterinarians, it was harder to diagnose, and really we only diagnosed crypto if it was kind of some unresponsive thing we couldn't seem to figure out. Now we're looking for it, and the more we look for it, lo and behold, we find it. And that's why I wanted to mention the EnteriCheck, and the clinics can do fecals. To look for those oocysts, the only negative thing there is the crypto especially are very small, and I don't know, my eyes are getting worse as I get older. I have a hard time finding them. So that EnteriCheck where you get a positive negative is a real help as far as leading us down the path to what you've got on your farm. So thanks for those comments, Dr. Thomas.
Okay, Andrea, I think that's all the comments we have right now, so you can go ahead and introduce your next presenter. Andrea, are you there? Are you there? Hello? Hello?
Yeah. No. Okay. Oh, she's trying to get it on. She's obviously
Hi,
listening.
Linda. Have you muted yourself?
I'll just push OK.
Okay, well, thanks, Linda, and thanks, Roy.
Hello? I seem to have lost.
I'm
Hi.
unmuted now. Can you hear me?
Yes, we can. Go ahead. Sorry, Andrea.
Sure.
No, Linda Fox, you can go ahead now if you're unmuted.
Okay, well, thank you very much. So my name is Linda Fox, and I'm a forage specialist out of the St. Rose office. And today we're going to take about 10 minutes to talk about the an app that's currently available for beef producers and iPhone users both here in Manitoba and abroad. It's the iCalve app, and we were fortunate enough in this area to receive a presentation from the developer. His name is Jake Meyer, and he presented to our area at the MAFRI, or Manitoba Agriculture, Food and Rural Development's Beef and Forage Day back in January. And from that, we gained a little bit of knowledge on what this particular app can do, and so I guess we just wanted to share it to see if it was a good fit for you and your operation. Maybe as your first choice for calf record keeping, or it could be supplementally used as a backup system, and we'll kind of go through how you would do that. A few quick things to tell you. At this point, the iCalve app is only available for iPhone users. He did mention, he being Jake, that they were hoping by March to actually have an Android version. And so if you right now are running Android, don't turn off just yet, because certainly they say that the app will look very much the same and operate nearly identically in terms of from the user standpoint, and we hope to see that here in the next month or so. So when we talked to Jake, he said really how I explain the iCalve app is that it's a calving record book on steroids. So I should mention at this point, it's not a management suite. It is designed for basic data collection and storage. For those of you who don't know about Jake, and to kind of feel like where his knowledge comes from and his background, he also is a cow-calf producer. He's from Canada and Alberta. And so his experience was he continued to bend over to check and or tag treat calves, and the calving book, which he kept in his front pocket, continued to fall into the mud. So with frustration, one day he came back to the house and told his wife, I am going to go on and get me an app on my phone, because the one thing that I always have attached to me is my phone. And he said, that way I don't need to be searching for a pen or the book or those types of things. And so with that, he went on the search for this calf app that he was looking for. And much to his surprise and chagrin, I guess, he couldn't find anything. And so that's when your fellow producer, I guess, this individual and his wife decided to take it upon themselves to try and develop something that was user-friendly and really made sense out in the pasture or certainly in the calving field. So generally, it's exactly what your paper record-keeping calving book is. So the columns, you can kind of see the first screen there. The columns they match up almost directly with what you've been used to in terms of writing them in. And so it's relatively easy to use. We'll just walk through each one of these tabs. So the first one on the upper left-hand corner are calf records. And so this is how you would input your information as calves are born. So obviously we allocate a calf ID, the cow ID, give the birth date, sex being heifer or bull calf, a weight, and then whether you've had to assist. And at the bottom there you can put any sort of notes that you want to attach, which could be things like aggressive cow or calf up and nursing within 15 minutes, right? Those types of things that you want to be able to recall later. Of course, death loss is kind of part of the production system that we're involved in. It happens. We don't like it, but we do need to keep track of it so as to try and minimize that death loss if we can. And so if you've already tagged that calf, then you would put it into this screen. It can be a calf, a cow, a bull, any animal that has been input into your inventory. So you would put their tag ID, obviously the date, the reason for death, and any notes there. So if you went out to treat them but found out once you got there that they had been lost, then this is where you would put that in. Maybe you would put something like initial clinical symptoms yesterday at like 12 hours prior to succumbing to death. And so that's what you would put there. And I think it kind of goes back to what Roy was mentioning earlier. Sometimes we just put death and we don't necessarily, when we look back 2 weeks later and we've had multiple losses potentially to the same culprit, we can't remember just how long the sickness was exhibited in a clinical sign in your livestock. And so it's important that you're able to do that. So we'll move just right on through. So this is the cull cow list. And so you would put the cull ID, and maybe she's crazy, or maybe she is chronically has foot issues, or it could be anything that you are culling for, and you would put the notes. And what I really like about this is it's just your cull cow list, so you can put her in at any time. You don't have to put her in the date that you're culling. You just put her in. Maybe she was a little goofy when she was calving, and so when you went to tag the calf and she came after you, you put crazy cow, and then you immediately put her in your cull cow list. You'll notice the red tab there that says delete record. And so maybe what she did was she settled in, and the calf was one of the heaviest weighted ones when it came weaning time. And so you can certainly go back in and delete that record. And when you print your list out come cull time, she will no longer be on that. So this is for when you're treating animals, and anyone who is a part of a verified beef program, whether that's here in Manitoba or elsewhere. This is certainly a feature that I appreciate. And so we can put in that information, and we'll talk about a little bit here in a little bit about exporting those records. And it's really nice because we can just print the records from pretty well your entire calving season, if not your entire year, and then you're able to put those records directly into your verified beef handbook that you'll need to continue to be certified. And so very important, this tab. Onto the gestation calculator or calendar. So all you do, it's a very simple application here. You pick the date that the date of service that the cow was bred, and very quickly on the bottom you'll see in the red that we assume that the calves are to be born then on December 1st if they were to be bred on the 19th. And so you can do it any time of the year if you're thinking, gee, I'd like to move it up or down and not to have to do much thinking about it. You just put in the date you're thinking to kick out the bulls, and it will tell you what time you're looking to see your calves. As we move on to the Export Records tab, it has the green arrow there on the left-hand side of your screen. And what this enables you to do is to export any of the records that you've input. And so whether that's you want to know all the calves that were born, whether you want to know all the calves that were lost and or cows, You can certainly sort by that to try and see when you're maybe looking at your cost of production. And certainly death loss is, again, what I mentioned earlier, a part of having livestock in general. And we do try to limit it. So if we can look.
Welcome to GoToWebinar, Webinars Made Easy.
Helpful application of that. You can also do your cull cow list, which is really, really nice. You don't have to think about how each cow has done throughout the year. You have kept your cull cow list kind of current all along, and so you have a list, and if when it comes sorting day or preg checking day and you are called away, you can print that list, and someone else can come to your aid in terms of who's supposed to get on the truck. So the herd data, it was listed there on the last slide, and so under the herd data you can have the year, which so you can see I've input 2014, producer name, Linda and Ben Fox, and then as we work down through, these are all things that you can put in and again export into a full-size paper PDF. So name of producer, name of operation, bulls turned in, bulls pulled out, your inventory, your bull inventory, sorry, your cow inventory, bull inventory, heifers, check date, all the types of information. So what you have ultimately is a PDF that kind of tells you, it's like a year in review. And it's really, really nice, I find, to be able to print that out and just say, keep it in your paper files at home to say this is kind of how we function within a year, and these are the things that we need to look forward to in terms of large events. And it's helpful too because certainly some things like branding or weaning, so many of our operations rely on outside help. And so if it's something that we can say, generally speaking, we are going to be weaning the first week in October, the first week in November. It might be a way when the older kids come home from school or when the neighbors are going to be available, you just have that snapshot right in front of you. One really important feature certainly here in northern Manitoba is many of us don't have cell service. And so one feature that this application has is that you can input into it even when you don't have cell service. So you can input when you're offline. Then when you are able to get back online or be in cell service, what you can do is anyone who's an iPhone user probably knows, but then you would just back up your data to what is called iCalve. So back it up to the cloud, and it will actually say, would you like to back up this information, which is really a helpful reminder. Another thing that has just recently been added to this app, so if you've had it, you've used it, and maybe you don't know that this is something that they've added, I think since the new year, is that if there are multiple individuals using the app for different things, maybe one person is out calving and another person is out treating as you're on different sides of the pasture or in different pens. The nice thing is that once you are back into service, you can sync the devices together. And so if I put the information into my phone and Andrea put information into her phone, once we were back both online, we could sync that information, and, or you could just back it up to the iCloud. So those are really important benefits that we certainly appreciate up here in the north. And with that, I hope that you find that it's a very user-friendly app because it's so basic. I think that when we've spoken with Jake, or when I've spoken with Jake, he has mentioned that there are certain things that people have asked to be put into the app, and one of those is kind of what I mentioned about syncing them. Other ones are things that would be a convenience, but they make the functionality of the app less. It lessens the functionality in terms of user friendliness and or the amount of storage space that it takes. And so it's not something that they look to put into this app, and one of those would be things like individuals wanted to put a picture with each record and things like that. And because of the amount of data that it would take, it's something that they aren't looking at doing. That being said, if you are using it or if you begin using it, please know that the other nice thing is because he's kind of our fellow cow-calf producer, he certainly appreciates any suggestions from my experience with him directly and to make this app better, because ultimately the idea is to make calving less of a stress and to be easier on both cow and operator. The other thing I should mention, if I didn't earlier, is the app is about $10, and I don't think that there is an interest in increasing that, certainly not at this stage. Another thing to mention is, again, I think I mentioned it earlier, but it's not a full management suite. There are certainly other applications out there that are. They can be pricey, so I would tell you that lots of the reason why we did this today is because when you go out to look at an app, generally you'll just get one screenshot and you don't know exactly how it's going to function, and if you buy a few of them, all of a sudden you've put out a little bit of financial contribution, and maybe you didn't find one that suited your needs. And so with that, those are kind of all of the tidbits that I can tell you with my short amount of use within this app, and I'm hoping that it will help you determine whether it's an app that would suit your needs and or at least get you interested out there looking to see if there's another app that benefits your operation.
Linda, just had a question. The only output that you can get from this app is a PDF, like you couldn't do it to Excel?
As far as I know, that is something that they're looking to do. I should go back. Let me see if I can go back. So you can move anything to a Dropbox, and so if you were going to, my understanding would be if you were going to export into Excel, it would likely be a comma delimited file, and at this point it's not something that it has the capability to do, but it is one of those things that they are working on. There's supposed to be an update right away, beginning of March here, and I haven't talked to them recently, but with fingers crossed, that is something that they hope to be able to do.
Okay, that's great. Andrea, did you want to take over from here?
Sure, if you can just get me, okay, there we go, show my screen. Okay, so that concludes our cattle chat for today. Thank you very much to Linda and Roy for joining us. I think there's lots of new technologies out there with smartphones, and more producers are utilizing those resources. So I think it's important to look into those and see if they fit for your operation. So thank you, Linda, for talking about that app. Here's our contact information. So if you have any questions that come up after the webinar, you get thinking about something, you can give myself or Linda a call, or if you have a question for Roy or that sort of thing, we can get you in touch with him as well. Any technical or any that sort of thing, Linda can get you in touch with the right person as well. So thank you all very much for joining us today, and our next cattle chat will be the third Wednesday of March. So we'll hope to see you then. Thanks, guys.